He didn't come. If we are together, we need a stakeholders forum in the health sector where everybody will come, and then we bring evidences to back up our position. And this will make the health sector to move forward. So we are using this forum to call on the Honorable Minister of Health that what we have requested for a stakeholders forum to discuss the problems in the health sector on one-on-one is very desirable, because whether you are a medical practitioner or physical therapist or what have you, we are all members of the same family. We must ensure that team spirit exists. Without it, we cannot do our work well in the clinics. That's
very well. We know that your call will certainly not go unyielded, and we want to thank you very well, National Vice Chairman of the Joint Health Sector Workers Union. Thank you for coming on Dateline Abuja.
Thank you very much, Gloria.
Thank you. Now let's take you back to the performance of the health sector in the year 2013.
At the start of 2013, all hopes were high that the sector would be relatively calm and progressive. Yes, a few strides in the right directions were made, but highly crucial grounds seem uncovered.
I think the president of the NMB
January 2013, the Nigerian Medical Association's first National Health Summit in Asaba, Delta State. Here, doctors and other health workers deliberated on moving the health sector forward, especially on how to slow down on strike actions and put in place a better intra-professional working relationship in the sector. But the signs of issues swept under the carpet from 2012 began to show in February 2013, when the joint health sector unions embarked on a 3-day warning strike and subsequent 7-day full strike in August for the implementation of a 10-point demand, which include skipping of Consolidated Health Salary Scale 10, non-payment of specialist allowances, and issues of consultancy status for allied health professionals.
It is on record that health professionals with requisite qualification have been appointed over the years as consultants. And what the minister tried to do of recent is to make sure that all these appointments were reverted, even those that dated back to 30 years.
In view of all the actions and inaction of our Minister of Health, Professor Chiku, we are calling on Mr. President to please remove him immediately as Minister of Health.
The medical doctors also have their grievances: inadequate funding of the health sector and residency training, errors in the existing salary structure for doctors, and other issues. First to call out its members in October for a 24-day strike is the National Association of Resident Doctors. And just before Christmas, the parent body for the doctors, the Nigerian Medical Association, went on a 5-day warning strike after several ultimatums to the federal government. The grass on which the government and its health workers fought are the patients and their family members.
Last month, now my son, you did for this thing on the level. And now, as they say, they strike now. We attend with my son.
The age-long rivalry between doctors and other health professionals became more apparent in 2013 as some issues raised by the enemy for a strike became a source of controversy.
Let there be a circular that, okay, if some people are skipping, let doctors who skip. This consultant village is causing confusion with regards to patient management. Therefore, for now, let us stop it.
From the Nigerian Industrial Court, that has given specific orders that the status quo ante be maintained with respect to health professionals who have been appointed consultants. I think it is contemptuous of that court order. A big insult to our intelligence for the NMA to list that as a conditionality for its members to go back to work.
Also in the year, the Minister of State for Health, Dr. Mohammed Ali Pate, suddenly resigned his appointment in late July in what is seen in some quarters as a result of a not-so-smooth relationship at the Federal Ministry of Health.
I have no hard feelings. The only thing is, inevitably, there may be one or two things that I may have done that may have inconvenienced other people.
Away from strikes and controversies, cholera outbreaks took its toll on the people As of November 2013, the Federal Ministry of Health estimated 1,623 cases recorded, with 86 lives lost in some states of the Federation.
We started from Ogun State, which is generally controlled now, together with Lagos State. But in addition now, I've had cholera this year in Oyo State, in Zamfara State, in Sokoto State, in Katsina State, in Plateau, in Nasarawa.
In health regulation, the hope of Nigerians for a National Health Act was again dashed this year.
A very slow processing of the National Health Bill, which is still under consideration by the National Assembly. In terms of regulation, I think the only fundamental event was the reconstitution and inauguration of the Health Regulatory Council.
Despite challenges in the health sector in 2013, a ray of hope was seen in Nigeria's polio eradication drive. According to the Global Polio Eradication Initiative, the total number of wild polio virus cases in the country as of December 24 stand at 50 against 122 in 2012. Polio outbreak is also increasingly geographically restricted in Nigeria, primarily in Kano and Borno states. A framework for regulating the chaotic drug distribution network in Nigeria also came into effect during the year.
We started the drug distribution guidelines to try to coordinate this coordinated drug distribution in this country. The pre-qualification of facilities that is ongoing by the WHO. Of course, the fight against counterfeit medicines has remained there.
A platform for private sector partnership in healthcare also came to be with the launch of the Private Sector Health Alliance of Nigeria.
We are starting with the first step, having a formalized, well-structured alliance that will, from time to time, collaborate with the federal government in the area of health care delivery, which is very important.
Year 2013 could not make the difference in terms of prompt resolution of all issues that trigger strike actions. Although recent preliminary health survey seems to indicate a reduction in maternal and child mortality, the country's health indices remain largely the same, with about only 6 million Nigerians on the National Health Insurance Scheme. Seeing to all these issues with strengthened commitment of all parties in the health sector in 2014 would do the sector a whole lot of good.
Well, thank you as usual for your mails. That's about as much as we have time for. Send your comments and views to the address and Twitter handle right on your screen. I'm Gloria Umezuke. Thank you for staying with us this week. See you again.